when you are post-graduating from this institution, and it is not only that you joined IIHMR to earn a degree, but you joined IIHMR to transform your professional career and journey. Please welcome for yourself that you have been selected at IIHMR University. Dear students, today is more than a beginning for you at IIHMR University for your academic program. It is the beginning of a journey for you, a journey of learning, a journey of discovery, a journey of innovation, and ultimately a journey for leadership. We assume that you are the future leaders of healthcare industry, not only in India, but at the global level. This is our assumption, and we feel that our assumptions really work in a right way. We see our alumnus, we see our alumni, they have reached the height in the healthcare industry, and they are leading and managing the healthcare industry throughout the world. You have come to IIHMR University from various diversities. You come from various backgrounds. You bring with you varied experiences, perspective, as well as aspirations. Yet, from today onwards, you share something which is very special for all of us, a common opportunity to become the part of an institution which has 4 decades of legacy. So now today, you are the part of an institution which has 4 decades of legacy in health management research area. I am also happy to share that IIHMR is the only institution globally which has focused unique way in the health management research area. There are other institutions, but IIHMR's uniqueness is that we do not do anything apart from health and hospital management, or we train, we provide the knowledge, innovations, and also capacity building only for the healthcare sector. So in terms of that, IIHMR created a legacy in the health management research area by providing their input at the national as well as at the international level. Sir, we work very closely with the government institutions, Ministry of Health and Family Welfare, and almost all state government in India in drafting their national health policies, national health program guidelines, and many other such things where IIHMR input are required. As a part of WHO Collaborating Center, we are invited by WHO at international consultation meetings to provide the input from IIHMR's ground level research, that what we have done our research and how we see the healthcare sector growing. Let me tell you one thing very clearly. Dear students, as you begin this journey, I encourage you to see IIHMR not simply as a place of academic institution for taking the degree, but as a place where you will discover your potential, challenge yourself, make new assumptions, make new hypotheses, build lifetime friendship and bonding with your colleagues, and also develop the knowledge and values to create the meaningful impact in the society. The healthcare sector is among the world's largest and fastest growing sector that we all know. It is not growing very fast in India, but globally the healthcare sector is the fastest growing sector. That means a lot for you. Since the sector is fastest growing, you will get huge opportunities for your career and growth. Therefore, IIHMR becomes one of the catalysts to transform your journey from this place and enter into the healthcare sector, which is waiting for you. It is undergoing a transformative change. The healthcare sector nowadays is undergoing a transformative changes, unlike the other sector or unlike what we have seen before. Technology is replacing healthcare, how the healthcare is delivered. Data is fundamentally being used, how the decisions are being taken in the healthcare sector. Artificial intelligence, very new term for you, but nowadays it is not new. artificial intelligence is opening new possibilities for all of us, for providers as well as for the clients, in diagnosis, in treatment, in prevention, and also in health and hospital management area. Yet, alongside these remarkable opportunities, we face a lot of challenges in the healthcare sector. In India, millions of people still face barriers in accessing good quality of healthcare services at affordable cost. So these are the major challenges we are facing, and you, as a part of healthcare stakeholder, your role is that to improvise the quality of care, to improvise the accessibility of the healthcare, and to provide the healthcare at the affordable cost to masses. The challenges before us, therefore, is not simply to adopt the new technology, but to ensure that the innovations translate into a better health outcomes. Our purpose is that people should live a healthy life and the better health outcomes should come. And all we are important stakeholders. Although your role is not as a clinician, but I am happy to say that you support the clinical interventions in such a way that they will also improve their efficiency in the hospitals and healthcare environment. Your role is very critical and very important as a managers and as a leaders. You provide all type of support so that the patient get a quality healthcare services from a healthcare institutions. Our students have gone to government sector as well as the private sector. When I say private, there are, again, you can divide into private for-profit sector and private not-for-profit sector. Everywhere you see the IIHMR alumni is working. You go to any hospital, any corporate hospital, you will find IIHMR alumni. You go to any state government, national health programs, national health missions, again you will find IIHMR alumni is there. You go to the Ministry of Health and Family Welfare, you will feel pride that IIHMR alumni are supporting the government of India in national health policies and national health programs. This is the healthcare landscape of our country and the place of IIHMR in the healthcare sector. The healthcare leaders of tomorrow, you are the healthcare leaders of tomorrow, and therefore you need to know not only the technical knowledge, but you will need competency, but also compassion. You will need analytical skill set, but also imagination. You will need confidence, but also humanity. And above all, you will need to courage to solve the real problems of the healthcare sector where the society matters a large. We need that society should benefit from your intervention and involvement. This kind of leadership we want to develop at IIHMR University. I am confident that today you are coming from various backgrounds and various cities and various states. I feel that, and you feel, after 2 years, you will find total a transformation in your life, in your thinking, in your assumptions, and you are ready for the healthcare sector. About these 4 days orientation program, which has been developed with very serious efforts have gone in designing the 4 days program. The next 4 days, like this is the day 1, where you are connecting with the industry leaders, stalwart. They are at the dais, and you have an opportunity to listen them carefully, their experience, their perspective, and how they resolve the healthcare sector problems. Learn from these stakeholders. That is the day 1. In the afternoon, we have provided you space that you yourself team up, know each other very well in an informal setting and through some activity and other things. Day 2 will focus on acquainting yourself with IIHMR ecosystem. We will focus in briefly that how IIHMR academics run, what are our values, what are our governing principles, and how you can perform in a better way in IIHMR community. So second day is more towards acquainting yourself with IIHMR ecosystem. Third day is basically understanding our living with our value system. We will tell you more about campus life and other things also. Fourth day, the third day, in the evening, we have also planned a cultural evening, and we have invited very prestigious Padam Shri Pandit Panditji, and they will be with you in the evening of 14th. On 15th August, we all will celebrate our Independence Day jointly and commit ourselves for the country's growth and building the nation in a good shape. So do not look at these 4 days as a series of formal sessions. These are all informal sessions. We are trying that you please be settle yourself in the IHMR community, in the IHMR campus, in the IHMR ecosystem. If you have any question, anything in your mind, please ask someone from our team. We have faculty colleagues, we have deans, we have registrar office. Wherever you have anything in your mind, please try to resolve these issues as early as possible. Last, my advice to all the newly joined students is very simple. Be curious. Don't hesitate to ask the question either in the classroom or outside the classroom. We are always open and welcome the student. Be open. You will meet people you don't know. Be open yourselves. Get the new things from your colleagues, your faculty mentors, your industry partners, and they are coming from various perspectives. Be responsible. Your time at the university is your investment in yourself. Please see that you are making an investment in yourself. So please see that every day is important in your life at IIHMR University. Attend your formal classes. Don't bunk. Be in the class. Be in the serious discussion with our faculty colleagues. If you are serious, the faculty will be more serious. If you are not serious, naturally the faculty will also not be very, very serious. So please make a serious interface with the faculty colleagues. Faculty are very distinguished people coming from a rich experience in the healthcare industry. They have done a lot of research, lot of innovations. All these will come to your class when you be serious in your classes. Participate in the class. Don't keep mum. Participation is a good methodology to learn more and more and very clearly. And read beyond the syllabus. Although we provide syllabus, but do not limit yourself at the syllabus only. You go beyond. There is a lot of opportunity on the Google and learn yourself. So self-learning is very, very important at your level. You are a postgraduate student. Learning depends on you. Faculty will facilitate your learning. When you were in the primary school, in other way, the teacher has the responsibility that you learn this thing. But at the postgraduate level, I think it is reverse. You come that you have the attitude of learning. And I think you will grow faster if you have that attitude. And finally, be useful for yourself, your family, and society. At the end of 2 years, I don't want to measure your success only by your grades or marks. I will ask a simple question after 2 years. What difference can you make in the healthcare industry after studying at IIHMR University? If you are able to answer that question confidently, we will see that yes, you have transformed at IIHMR University. Dear students, a university can provide you resources, classrooms, faculty, computer laboratory, technology, library, everything. But you make the opportunities in ultimately that is your responsibility to learn from all these things. You are entering into the IIHMR community today as a student. After 2 years, you will part of our alumni status. Our aspiration is that you leave this institution as a professional who can lead and manage the healthcare industry wherever you go, either in the public sector or in the private sector, at the national level or at the international level. Either it is hospital, government institutions, healthcare programs, analytics, startup, wherever you go, pharma industry, but your role is that you are managing the healthcare industry. So dream big, work hard, and stay grounded. And remember one thing very clearly during your journey. Your degree will open doors for you. Your knowledge will create opportunities for you. But your character and your impact will define your legacy in the healthcare sector. Once again, I welcome you, each one of you at IIHMR University. Welcome to your university. Welcome to your community, and welcome to beginning of your journey towards the leadership in healthcare. I wish you all be transformative, fulfilling, and memorable 2 years at IIHMR University campus. Welcome to the IIHMR University. Thank you. Jai Hind.
Thank you so much, sir. Your words were not merely a welcome, they were a vision, a reminder that healthcare is a responsibility towards humanity. True leadership is measured by the lives it transforms. Our next distinguished guest has spent over 3 decades transforming healthcare organizations into institutions of excellence, beginning his journey with Apollo Hospitals, leading strategic growth at Wockhardt, driving innovation at Fortis, and today serving as the CEO of Motherhood Hospital Group, where his leadership has helped scale one of India's fastest growing healthcare networks from 3 hospitals to 25 across 9 different states.
Dear students, today you have the opportunity to hear from someone who has spent 3 decades building healthcare ecosystems that touch millions of lives. Please welcome with a resounding sound of applause, Mr. Vijayaratna Venkataraman. So,
A warm good morning to all of you. A warm welcome to my co-dignitaries on the dais, the wonderful faculty, the new students, and I do see a couple of parents, I guess, here. It's a wonderful morning today, and I'm very, very happy and excited to be here today because one of my bucket lists got ticked. This is my first visit to Jaipur as well as IIHMR. So I've always been wanting to visit this wonderful institution as I've been involved in the recruitment of students from this institution for over 20 years now. Starting from my early days of Wockhardt and then continuously, we've always been onboarding students from these wonderful institutions. And I must say, and I must congratulate all the faculty that you really produce some of the finest students. So I should also say that you students who have joined this are really, really lucky to be a part of this institution, which is, as Professor Sodani was mentioning, this has completed 4 decades and produced phenomenal amount of talent into the healthcare industry today, who are occupying multiple positions across this country and even outside. That goes to show that this institution has got something right, very, very fundamental, that's training the students, educating them and liberating them into the world as free thinkers, try out new things, try and experiment and be innovative. That's what we see in the students who come and join us and then go on to grow in our institutions and then go beyond and do extremely well. So I am very happy, and I'm sure that I'm going to really enjoy my day here today. So as all of you know, healthcare industry has been growing at a very, very fast pace for the last 1 decade, definitely. As a part of, sometimes when people introduce me saying that I've spent 3 decades in the healthcare, it does make me feel a little old. But I can also bring in some of my earlier experiences to make all of you understand how this industry has transformed. An industry which was largely managed by doctors in the early days, right? And then later came into a professional institution, and today we call it as a healthcare industry, right? So it is an industry which is delivering a significant amount of contribution to the economy of this country, right? In the last decade, all of you would be very closely observing the number of new institutions, the number of expansion programs across various networks, leading networks in this country really is made a significant impact. And that is a great opportunity for all of you to take up newer positions in these organizations and then try and grow. In my day, the technology was not very easily available. In the early 2000s, when I was trying to buy a new cath lab, and that was being positioned as the first in the country, I asked the guy as to, when you say this is the first time in the country, are you saying that this is the first time in the world, or how old is it in other countries? He said, no, this model has been introduced in the US about 8 months back. You are getting in India now after 8 months, and this is the first time in India, right? So that used to be the technology gap between the West and us. Today, new products are being launched in our country, right? We are in real time getting technology from whatever is being introduced in anywhere in the West. We are able to get the same technology on the same day in our country too. That's a huge change in the way that the healthcare has grown over the last couple of decades. As all of you know, that the industry has been gaining much pace, and we know that the investments that are coming in is an indication of how the global investment companies are looking at this country as a very potential growth opportunity. When we say growth, it's not just the financial growth, it's also an opportunity to establish and grow and bring a phenomenal amount of quality healthcare into this country. Today, Tier 2 and Tier 3 cities are able to access high quality healthcare. All the global and all the leading networks in this country are able to expand into the Tier 2 and Tier 2 cities. It is also an outcome of the socioeconomic status and the understanding and the awareness amongst the people that health is very important. We can divide the healthcare time frame into two spectrums, one before COVID and another one after COVID. Before COVID, the awareness around the healthcare, or the attaching importance to the personal hygiene and healthcare, was significantly lower, I would say. Post-COVID, the awareness on healthcare has significantly improved, and the healthcare insurance penetration was just 3% before COVID. Today, we are at about 14%. We are still far behind, but a country of 1.4 billion population move from 3% to 14% is a significant jump, right? So today, the ability to pay and access high quality healthcare is improving, and it will continue to improve in the coming days. And that again will encourage a lot of new players to boldly set up high-end, technologically advanced healthcare systems in the country, going beyond the larger cities. Today, cities have grown a lot, and even quaternary care networks like Manipal has 13 large hospitals in a single city, right? Close to about 2,400 beds in Bangalore alone, right? So that goes to show that the consumption of healthcare, quality healthcare, is continuing to grow, right? As motherhood hospitals, we have 8 of them, but we also are today going beyond, right, the large cities and establishing ourselves into Tier 2 and Tier 3 cities. And that is going to make a significant difference. So far, we all have been, looking at the pace the industry is growing, we all have been always discussing about the patient doctor ratio, the patient nurse ratio. I think the time has come to also talk about the healthcare administrator versus hospital ratios, right? So there are a lot of new hospitals who are coming up, and they all need very well trained healthcare managers and healthcare administrators in the country. And many of them are today being managed by probably people who have come in the system over a period of time, not necessarily a very well trained professionals like you. So you all have a very, very interesting future in front of you. You all have a very great opportunity to go and establish yourself and contribute significantly into this industry. So Professor Sodani was talking about artificial intelligence. I think in today's context, no talk is complete without mentioning artificial intelligence. As he was mentioning, it was a vocabulary a few years back. We are realizing and we are really feeling that it is right there and in front of us, and we all need to adopt. I don't know the curriculum that you all have. Would you be having anything specific to the students on the artificial intelligence? If not, I would say that we must all try and engage and understand. You don't have to become an expert in AI, but it is very important. One of the things that we see, right, as personally, which we all as hospital leaders face, is that how do we transition the clinical and the technology, or the adoption of technology in the clinical space. Now, most of the hospitals, we all have softwares, we all have things where we try and bring in the adoption of clinical part of it. Large number of the softwares that we all use in the hospitals are largely systems that enable transactions that we do in the hospitals, not necessarily the clinical part of it. Today, most of these softwares are adopting the clinical aspect also, but the adoption from the clinical side is fairly a challenging aspect. But we all see that it is changing. As the younger generation doctors are coming, the adoption of medical records, electronic medical records, is becoming more and more easy now. But one thing we all must understand and keep in mind is that going forward, the digitization is the way forward, and those hospitals or those institutions do not adopt the digitization, which eventually will form the basis for AI. For us to AI, when it comes, we will be able to really save a lot of time that we currently put in as manual labor in analyzing your data and decision makings that you go through after that will significantly be cut down. But the first step is to digitize your entire system. So you may all wonder, as hospital administrators, how do I make that happen? You need to adopt, you need to create platforms where you are able to onboard people. And the one way that we have, and most of us are realizing now, if you want to bring in a clinical digitization, the first set of people to onboard is the nurses. No digitization process in a hospital environment, in the healthcare system, will be complete or will be implemented without the nursing team being onboarded on that. Keep that in mind, and whenever you are being exposed or experienced in your hospitals when you go for your studies, just observe how the nurses are adopting to this, or what kind of clinical data that they are churning out, and if that gets adopted, how quickly the hospitals can transform itself into a digital platform. That's a very important thing. Most often we end up starting the entire digitization from the administrative side, but I think we need to flip that and make it from the other side, largely started from the nurses and then take it to the doctors and then come to the administrative side. That way we will, but it is going to be a very important and key aspect. And, the sooner we all do that, the better for us. And I would say that today last time when I was meeting someone, they said medical colleges are adopting the digital one of the courses they also have now on the digital technology. I think even IIHMR should consider and try and bring in something in those lines, which would be quite useful. So when you go out there, you're already well versed to adopt those scenarios. So as healthcare managers, you all are very, very fortunate because you have a very unique opportunity to apply your business principles, which every business will adopt and apply in a very empathetic environment. I always say that, healthcare industry ecosystem has grown over the last many years by actually co-opting with talent from other industries. In the early days, apart from IIHMR and probably, I don't recall because there were only two other programs. One was in AIMS and one was in Nizams in Hyderabad. And those two courses were exclusively for doctors. They don't take, and they had only 4 seats each in those institutions. I do not know what's the status now. So as a healthcare institution training healthcare professionals, it was only IIHMR that was producing students who are training healthcare professionals. But of course, in a vast country, they could sort of churn out talent, but it wasn't enough in those days. Right, today, we have a very unique opportunity. I think you must have churned close to about 20,000 students into this country. Yeah, the country is growing and it's still not enough, but I think you are doing a great, wonderful work, because I would not be able to recollect a large hospital network or a very, very good large hospital in this country which would not have had a student from IIHMR. Right, so that's the kind of institution you are, engaging, you are joining, and you have a great future. And I wish all of you and a very, very bright and wonderful future. Thank you.
Thank you so much, sir. We were truly honored to hear your thoughts.
Now it's time to hear some numbers. 28 years of experience, 11 states, and today 23 hospitals. Sounds fascinating, right? Our next speaker has spent nearly 3 decades understanding what it truly takes to make healthcare work, leading academic hospitals, primary care networks, and large-scale healthcare operations, with expertise spanning in hospital operations, mergers and acquisition, and public-private partnerships.
And today, he serves as the Regional Chief Operating Officer, South and East at the Manipal Health Enterprises, leading the strategic and operational management of 23 hospitals, and he's a proud alumnus of IIHMR University, Jaipur, someone who once sat right where you sit today. So ladies and gentlemen, put your hands together for an extraordinary healthcare leader, Mr. Deepak Venugopalan, sir.
Very good morning to everybody. I think it's kind of humbling experience to be in the middle of a stage where you have my teachers with me, Dr. Sodani, Dr. S.D. Gupta, late Dr. Kanjilal. I think a lot of it that I am today, and I don't hesitate to say this, is because of the foundation that all of you laid in my life. So a big round of applause to all of you, sir. I think respecting your gurus and teachers is a fundamental that some generations like us followed. And my only request is that the new generation will also follow that, because it is the process of teaching that comes into your life, right? When somebody teaches you something, you need to learn from them and absorb what they teach. So I think that's something which we should all take in our lives. But like Neha was just saying, and also it's good to see friends like Vijay and the rest of the dignitaries on dais, that this is truly a nostalgic moment for me. 28 years back, like the young lady has said, I was sitting on the other side, right? And things were very different then. I mean, there was no concept of healthcare administrators. Either doctors managed the hospitals or retired army officers. So that was the era when defense personnel used to run hospitals. And incidentally, I was a placement committee member. So I was really trying to get jobs for all of us. We were a batch of 20 to 24 people. And I remember there was no LinkedIn, there was no Gmails, there was no nothing. You had to literally search the names of people who are running hospitals, find out what the postal address is, then make a brochure, send letters, handwritten, sometimes typed. Dot metrics was just coming, so I think Vijay said that we look very old because of this conversation, but that's the reality. I think we are all getting old. But dot metrics printer used to be there, and then we started sending it across the country. The Hindujas, and then there was, of course, Wockhardt was quite favored place at that point of time. And the institute allowed us to spend some money, and we hosted the first placement committee thing in Taj Mumbai. So it was quite a huge experience, that the iconic Taj Mumbai in 1998. We went there and we started talking about healthcare administration, right? What is healthcare administration about? And people were viewing us very suspiciously, because why are these guys making such a big fuss about something like healthcare administrator? And it's already chal raha hai, to chalne do, kya farak padta hai, right? That was the whole attitude. But then slowly, I think the way the industry has grown, today institutes like us come in queue to all of you, right? I mean, there is a campus day zero aspiration that large companies have to be in this building. We try and attract the best talent to join us. So it's like a role reversal now, right? And I think a lot of journey has gone in that, where earlier we used to go behind, organizations to recruit. Now the organizations run behind you to get recruited, right? So I think it's a great space to be. And I think all of you must feel very proud about the fact that you come to an institute where the industry respects the institute. And I'm not saying because I'm an alumni here, because I also go to TIS, I also go to, ASCIIs of the world. We recruit from the IIM Bangalore as well, IIMs of the world. But IIHMR has a very, very special space in the corporate industry. And Vijay talked about motherhood, Neha will come. Any brand does have a lot of respect, and that is because of the legacy that we have maintained, right? I mean, the legacy of faculties, legacy of students. Finally, the institute gets represented by the students who come out. So I think there is also a responsibility on all of you to kind of come out of this place saying that, look, I'm carrying a 30 years of legacy with me. So all the best with that. I'm not putting any pressure on all of you. But one thing that has not changed in last 28 years is this whole emotions, right, at this point of time. I mean, I think I felt it 28 years back. I'm sure all of the students here must be feeling these emotions of joy, right? The joy about what you've achieved in the last couple of years. You've done your graduation, got selected. There's an excitement inside. I'm sure that excitement to say that it's the start of a career. So there's something to look forward to, right? There's hope, and this excitement is contagious, So for somebody like us who are always into this day-to-day pressures of running hospitals, delivering results, building new structures, it's a nice place to come back here, because you feel that little nervous energies of all of you, a little anxiety of aage kya hone wala hai, mera future mein kya hoga. You've got parents here, they will be thinking ki bachcho ko sahi jagah dala ki nahi dala, right? There's a feeling ki am I in the right place? So that energy is very, very contagious, because that energy makes you do more, right? So I think that's another emotion that was there when all of us were here. And of course, the last part was this whole hope, because I think you need to keep dreaming this hope constantly, that I am in the right place, I'm doing the right stuff in 2 years, and I'll go forward from there. So these 4 emotions were still there and still here now. The thing that has changed is, pehle hum log bhagte the, students to the corporate, now the corporates come behind you. So it's a good space to be, happy space. So I am not going to take too long. And what I want to do in next 8-10 minutes is just to give you 2 perspectives. One is personal, one is professional, right? And hear me through. And I don't want to sound like a lecturer. I think I'm using this Generation Z, right? They have used this word called "don't infantile me." Aapne suna hai na? Anyone has heard word infantile? I mean, the young kids should know. Aapko to, sir, I'm good to hear you have heard of it. So I've been reading about infantile is don't treat you like children. Don't treat you like kids, because you are definitely right up there where this is like a dialogue. I'm not here to give you any advice. I'm not here to give you any lecture. So please take my inputs as a pure peer-to-peer conversation, right? So see it, what can resonate with you, what connects with you, you can take it. What doesn't connect with you, leave it. I mean, it's completely respectable to understand that you may have different views, but I'm just talking from what has gone through my journey, and some of it has been around the fact, in fact, we have a very active management trainee programs, and a lot of our management trainees contribute heavily into the growth of the company, right? So I'm meaning it when I say that we have a lot of respect for the young generation that comes in, because they change our perspectives, right? We are typically sometimes hardcoded in the way we think, and this is the best way to do, but sometimes you give a new fresh perspective. So there are a few things that came to my mind. I've used the word that these are some 6-7 toolkits, right, which makes work. So one is very clearly protect your self-worth, right? हम लोग का जो क्या बोलते हैं, आत्मविश्वास बोलते हैं इसको हिंदी में, कि मेरे को जो लगता है मैं सही हूँ, that feeling is very critical to preserve in your career as you start. Because a lot of times you may feel ki, am I really worth it? Am I really worth the whole conversation, right? So please preserve your self-worth always. Don't let anybody tell you you're not good enough, right? So you have to always feel I'm good because I'm where I am. I'm good because I'm in IIHMR. I'm good in this campus. That whole feeling of goodness and self-worth is very important. So that's one part which I wrote, protect your self-worth. So that's one. Second, I think, is pairing humility with respect, right? I think you need to be humble. All the time when you go back to a campus, you go to an institution, you will see a nurse who is 35, 40 years old in the system. You will see a housekeeping staff who is there. Unless you are not humble enough to question, ask them, learn from them. And this is common for a pharmacy course. I mean, when you go to a pharma floor, or if you go for a public-private sector where an IIMR, this Ayush team is sitting somewhere in a PSU, or what do you call that? Sorry, the public health centers, PSCs, right? Yeah, primary health centers. So you will meet people who are not qualified like you are not trained like you, but have knowledge. So if you do not have the humility and respect for them, you may sometimes end up losing that knowledge base that comes in. So that's the second point I want to say, that ensure that you have that kind of, you pair your humility and respect. The third thing that came to my mind was this whole, okay, so this is like a quick thing that I got in the morning flight. So I had 2.5 hours to travel. So I put this all together. So flow may go up and down. But the third point which came to my mind was this whole mastering the chaos and ambiguity, right? So healthcare is like a chaotic place. आप सुबह उठोगे, you will say मैं काम पे जा रही हूँ या जा रहा हूँ, and you will not know what hit you. Suddenly your goalpost gets changed. There is a crisis in the hospital. There's a crisis in the pharma factory floor, wherever you go. But you need to be very comfortable with chaos around you, right? And then a lot of us sometimes become very agitated. कि बस ये एक route पे क्यों नहीं जा रहा है? So you need to keep pivoting to new ideas, new thoughts, so that nothing which is written in, this is the right way to do it. So if you can somewhere get your mind open, ki I will thrive in chaos, no matter what the situation is, it will help you take a lot of growth, This always happens, especially when some of us feel ki, if you're toppers in class, everything has to be perfect, right? Sometimes perfection doesn't work in real world. So when you go out to the real world, you will find people are not really, responding the way you wanted to respond. You want everything to be in a particular order. It may not. Hospitals are extremely chaotic. There are times where you have, patient complaints, you have doctor issues, you have material supplies issues, you have COVIDs coming in the world, you have a government change in policy that comes in. You need to keep thinking fast. You cannot be rigid. That's the third point I wanted to say. I think the next connected point is this whole thing about own the full transaction range. So today you need to deal with the housekeeping staff, you need to deal with the cardiac surgeon, right? That's the range you deal with. And there's no job, बड़ा job, छोटा job कुछ नहीं होता है इसमें. जैसे ही आप जाएंगे कि मेरे को designation क्या है मेरा, right? I mean this RCO, all these positions are just designations. कल हम लोग वो designation छोड़ दे तो हमारी value खत्म हो जाती है. That is the only worth of a designation truly. So do not chase designations. feel that, look, am I able to learn from this job, right? Am I able to contribute to that place where I can do anything? You know, tomorrow you go to the hospital for the first time, somebody says, can you do a night shift? You should grab it, because raat mein jo hospital chalti hai, there is so much of learning coming from there. Somebody says, go and be in the laundry department for a day or two, grab it. Somebody says, go to the mortuary and be there, because mortuary mein the whole experience of a patient dying and handling the relative is very different, right? It's a very emotional moment. People die, you have to deal with them. That learning is invaluable. So unless you do not have this range, you cannot always be in an AC room feeling ki boss, this is my dream destination. It doesn't work, right? You need to go on the ground, be on the sales team. Again, you know, I think some of us have done sales job, right? You go into a doctor's chamber, wait outside, you'll feel humiliated. 1 घंटा, 1.5 घंटा wait कर रहे हैं हम लोग, but करना पड़ता है. Once you do that, you become more stronger, and then maybe you feel कि I'm in the right place. So that's the fourth point I want to talk about, that somewhere, you know, be flexible, have the range that you do. Another is this whole normalizing disappointment and failures, right? I think a lot of times our threshold to deal with failures is very weak. And I'm not saying this like a general statement, but generally we do not know how to handle failures. So a lot of times you will not get it right. You will try with something, the work doesn't get done. आपके जो superiors हैं, colleagues हैं, they will say कि this is not what it is. But how do you bounce back from failures? And disappointment is also a big art. So please spend time on that. कि how resilient are you, in your mind? कि ठीक है, गलती हो गई, I'll repair myself. I'll do something better next time. That is the attitude which will make you survive this industry. The moment you feel कि I have lost it, I made a mistake, I can't do anything, then we have a problem in life, right? So that's the sixth part. And seventh, I think, which I feel is most important, is this whole 3 pillars. I think, the first part of our life is all about learning. I think Sodani Sahab talked about it, that, please learn as much as you can. The middle part is when you earn, and that's when the money starts coming in. So don't chase money. Don't say कि इतना lakh salary से मेरे को कम नहीं मिलना चाहिए. No, it doesn't matter. As long as you're learning from the first job, learn, because money follows you later. And then is this whole thing about returning, right? So you return back to the community. So earn, learn, and return. These are 3 words that came to my mind that is the way you should phase your career out. So far so good. I mean, I've just covered some thoughts, and I know this format doesn't have a question and answer session, but I'm around after this. We can speak more. Would love to hear from you at some stage. But these are the personal part. Now, where is the industry moving in this context is where I think I'll just add to what Vijay mentioned about it, is this whole convergence, right? I mean, you are actually converging between a primary care, a secondary care, a tertiary care, a quaternary care. So there is so much of healthcare which is all becoming one big bucket, right? So today there is a hospital that will want to keep you healthy, right? There's a hospital that will want to treat you when you get sick, and there's a hospital that will want to rehabilitate from you. So there is nothing which is now compartmentalized anymore. So I think the whole convergence is something which I would feel that has been a major transition in healthcare, and I think all of us should be mentally ready for taking that into our force. This whole continuum of care that we call. The second thing is this whole locational shift. So earlier hospitals and healthcare delivery was only in the hospitals, right? Today it has changed. So today you have something that happens in the hospital, then there is something that goes out of hospital in your homes. So the entire treatment that happens in home healthcare is big ticket. And then this entire online burst, right? Online digital healthcare. So no longer hospital learning that all of you do today. Do not get compartmentalized कि मेरे को एक ही building में घुस के hospital चलाना है. It's no longer that format. You have to be flexible. You may have to do a digital healthcare. You may have to do home healthcare. You may have to even get back into healthcare in the hospitals. So have that whole range ki it's no longer compartmentalized, right? Today, that's the big change that's happening, where you have, this whole convergence that's happening. Yes, and then there is this whole big discussions about AI and technology and, artificial intelligence, digitization. I'm saying these are all important, but the fulcrum is still the human touch, right? I think do not lose that, because today, if I spend half the time looking into a computer and not talking to you, you would not get the connect with me, right? So I think as much as there is an importance of digitization, there is AI coming in, we at our hospital chains use it extensively, but do not lose the human touch. आप लोग you call it the IVR phone करते हैं ना हम लोग, कोई एयरटेल का कंप्लेंट करने के लिए, जैसे वो IVR में आवाज आता है तो फर्स्ट होप इज कि कोई ह्यूमन वॉइस भी सुन जाएगा उसमें, right? That's a feeling कि at least let me listen to a human voice. In healthcare it becomes very important, so we should not lose that touch of the human touch which is there with AI. The second big shift is about this whole consumerism, right? Earlier patients were called as patients, and which meant ki it was a one-way direction. But today patients have become customers, and I'm not sure how all of you would react to that, but the fact is that patients have become customers because they have a choice, right? They can go to hospital X or hospital Y. They have a choice to decide what works for them. So this entire shift of treating patients as customers also makes you more accountable, right? So you have to deliver good service. We at Manipal do something called, we tried it about 8 years back. It's called the Manipal Patient Pulse. You know, what we have done is that if you, and then we make mistakes, right? I mean, nobody can claim कि I'm the perfect hospital, सब ठीक चल रहा है, कुछ गलत नहीं है, वो होता नहीं है. There are mistakes we make. But the beauty is कि if we make a mistake, we call that patient to our boardroom and get him to give or her a complete feedback of what went wrong. Now that's a huge learning experience, right? Because they'll come and say कि खाना खराब था, nurse late आई, bed pan नहीं दिया था. But unless you don't listen, you will not be able to improve your hospital setup. So please be in a mindset that we are now in a service industry. It is all about treating the patient with dignity and respect, giving them that flavor that you are important and you have a choice, right? And this is not something which I'm saying Gandhiji used to say many years back. I don't know if you heard of that post office example he said. But this is a fact that the most important person in our hospital is a customer. So the shift is very important. Related to that is this whole thing about, you know, if our employees are not happy, then you can't treat your customer well, right? So that's the third component. I talked about technology, I talked about patient service, customer, and third is this whole big story about employees, right? I think if we do not treat our employees with respect, why is it that we don't have a Infosys in healthcare so far, right? I mean, Infosys is a respected company, or, you know, I don't want to take any other example right now because not many great companies, but Infosys at one point was that epitome, right? In healthcare, if you want to create an Infosys of its sort, it's the way we treat people, right? So I think the culture of people is important. Like I said, you know, a nurse, housekeeping staff, security staff, FNBs, your liver transplant surgeons, you know, the CEOs and CEOs of the world, everybody is in that caregiving perspective. So if you don't treat them with respect, they will not feel happy about the job, and then they will not take care of the patient that you do. I mean, we do a lot of stuff with the nursing community. I mean, these are these young kids, just like all of you doing our MHAs. There are, I'm sure at this point of time, visualize this, right? I mean, as you're studying your MHA, in some nursing college, there will be a bunch of boys and girls who are studying nursing, right? And there will be a bunch of boys and girls who are studying OT technician course. And you're all coming out together into the industry. And how do you collaborate with them? How do you create a relationship of equability? How do you create a relationship of respect becomes very critical. So please take time to understand that as you come, make a place where employees are respected. That's the third point I wanted to say on this. I'm just going to start closing up. I know I have 15 minutes to do this, and yeah, and then of course there is this whole science of you know, the responsibility that we all have towards changing the healthcare behavior in the community. So it's not just about business. It's about how do you educate patients, how do you educate consumers, how do you tell them that, you know, and think again, the previous Vijay mentioned about COVID and post-COVID era, right? How have you trained people to be more healthy? You know, how does it help to keep people outside the community treated well? That's a whole space which is coming where the healthcare behavior is going. And then there is this huge piece around the CSRs, right? I mean, at the end of the day, no matter how profitable a company goes, you need to be making healthcare affordable. So I think there are speakers coming after this in the public sector, and some of you will do the Masters in Public Health. You will play that role to see how healthcare can be affordable, but everybody should have the social responsibility. And I heard Sodani sir saying that once you pass out from here, what are you going to contribute back to the community, right? It could be anything. It could be adopting a small school. It could be doing a camp somewhere. It could be creating awareness about women's health, right? I mean, there's so much happening in these spaces. Please keep your mind open that, how do I keep myself relevant by being a part of the community, do activities which can take people together. So that's become very important, and you feel good about it, right? I mean, one way of saying that I'm doing to the community is to pay my taxes, right? I pay my taxes on time, so I'm doing something for the community. But how do you go beyond that, right? What is it that you feel I'm helpless, not I cannot do, but you feel I can do it because I'm part of this community is very critical. So start now. I think, these 2 years. So don't wait for 2029. I think you'll pass out in 2028, right? So don't wait for 2028 ki ek magic wand ho jayega August ko, and you become different. Your journey starts today. So how do you relate to your community? How do you relate to your peer group in the classrooms? How do you kind of work with the other sections? So today, if you are doing an MHA, you can talk to the MPH teams and find out what are they doing differently, right? So if you do not collaborate with each other, you will not learn. So please keep yourself open for that. I'm sure the faculties and the system will allow you to do that, but keep yourself open to collaborate. That will be very fine. So this is where I think, so I would feel that at the end of the day, it's a great place to learn, but the responsibility is not just on the institution, right? Please be sure that it's your responsibility that the peer groups define any pedigree of any institute. So today, if you have one of the finest B schools in the world or the country is defined by the quality of classroom. Okay? So quality of classroom is not defined by the audio visuals or your air conditioners or the tools and techniques. It's about how the peer group does. So please define that peer group amongst yourselves, that you talk to each other, ask questions, create those group discussions, project work that you do together, because that will eventually become your real asset, right? I mean, in the library, I may have my dissertation which I had done in 1999. And this was a 360-degree feedback survey which I had done. And last time when I came, it was there, but I'm sure now they must have thrown it away somewhere or put it into one of those, no, it's there, okay, I'll go and have a look at it. But I'm still proud of that output, right? So do not think that this internship or dissertation is just a academic requirement. It is something that can define you, because it's the time when the company sees you, right? 2 years up, 6 mahine bhi rahenge, 2 mahine bhi rahenge unke saath, they will see that this is this boy or girl who has a sharpness. They'll pick you up from there. So do not take these dissertations like a curriculum compliance. Take it as a serious activity, and I'm sure it'll help you. So I think those are a few thoughts in my mind, and then I will just conclude by saying that finally, this whole mind, body, soul concept. So nourish your mind by obviously all these activities we said. Read, peer group, intellectual development is very important. Body, again, I think keep yourself fit. I think the physical stamina is very important in the industry. You have to keep your mental resilience and physical resilience very high. The last part, I would just end all of you with a thought of this whole soul nourishment, right? And what do you do for your soul nourishment? Because that's when you realize that you have to contribute back. You're in a great industry. Trust me, it's my 28th year now in the industry. I will not change this for anything else, because the ability to contribute and ability to take care of people's life is priceless, right? Even now, once in a while, everybody asks, can you do this to help me out? Somebody's sick somewhere. During COVID, pan-India, we could solve people's problem by, helping them whatever way you could. So please be blessed that you are in the right industry, and nourish your soul. I mean, meditate, pray. These things help, because you need to be very strong when you come out of this place. Because the real world will be tough. But I'm sure that all of you will do well, and God bless all of you. And at any stage, if there's anything that I can do in my capacity as an alumni, we'll be more than happy. But once again, proud to be here, and all the best.
Thank you so much, sir, for your enlightening and engaging words. It is indeed an honor for us to have you with us today and hear from you.
Our next speaker brings around 15 years of experience in healthcare and public sector consulting and currently serves as the partner Health Transformation at Grant Thornton Bharat. His work focuses on building future-ready healthcare ecosystem through strategy, digital innovation, and public-private collaboration. With experience and expertise spanning AI-enabled healthcare, digital health, and strategic investment,
He works at the very intersection where healthcare meets technology and innovation. That is your future battlefield. So today, don't just listen, challenge your thinking, ask questions, and imagine possibilities.
with the loudest applause, please join me in welcoming a leader who is helping shape the future of healthcare, Mr. Nilesh Maheshwari, sir.
Thank you. A very good afternoon to the respected presidents, faculty members, distinguished guests on the dais, and all the students who are starting their journey today. At the outset, let me all congratulate you all. I think you should all be proud of yourself where you are beginning from. I think all of you have gone through a journey to come to this premium institute, and as my earlier speakers have said, this institute has a very long legacy of providing a very strong platform for healthcare. I've been in the healthcare field for almost 15 years, more than 23 years now in the government sector. Everywhere I go from a healthcare perspective, whether it is policymakers, whether it is UN agencies or governments, national level, state level, even in my own firm, some of my most senior colleagues, all are from IIHMR, and you will always see that they'll be able to help you, guide you whenever you interact with them. So you should all congratulate yourself in terms of coming to this premium institute and starting your journey on healthcare. As I mentioned, I've spent over 20 years in healthcare, and I think today healthcare is transforming like anything. The next 20 years in healthcare will be very transformative journey. It will be amalgamation of policy, financing reforms, technology, AI, all coming together to change the way we are looking at healthcare. And that is why it is very important that we have healthcare leaders for tomorrow who can bring together all of these aspects and lead for the healthcare for tomorrow. I think agility, curiosity, and continuous learning will be essential for all of you to be able to start making and building your careers in this area. If I were to leave you something today, and being a consultant all my life, I work in tools and frameworks, so can't really escape that. So I'll leave you with a 5P framework. You may want to retain it, or you may want to use it if you like it. And these 5 Ps is more not just in terms of the next 2 years, but over the span of your career and your life, which you can use. The first one of this 5P framework is pivot. I think keep your minds open. I think we all our journeys started as students. I was there sitting in my MBA institute 22 years back, thinking about how this career would span, what will happen to my academics, will I get placed, where will I get placed? I think what you should remain open is in terms of experimenting as much as possible in your first initial few years. I heard Dr. Deepak mentioning you should be open to continuous learning, to collaboration across areas. Healthcare is a very vast field when it comes to public health, policy formulation, pharmaceutical, healthcare providers, now medtech, digital health, all of it. You can have multiple areas to work on, multiple areas to learn from. So keep your mind open in terms of where you want to go, where you want to work. Be open, be curious, ask as many questions as possible during your time here, even at the start of your career, during your internships. That will go a long way in terms of you understanding your strengths and the areas you really want to focus your career on. The second P on this framework is perseverance. I think you will find healthcare as one of the most complex area. Nothing really moves simply on the grounds. You will have policy written in a different manner, but being implemented in a very different manner on the grounds. You'll have inconsistent data sets. You will have a lot of technologies being implemented, but not talking to each other. You will see a lot of fragmented systems. And you will need a lot of patience and perseverance to be able to see that changes are being made on the ground if you really have to make things work. And this is what will come in handy during your stage here in the institute, as well as your careers. I think from a student's perspective, I think when concepts are difficult, stay focused, ask again and again, take help from your fellow students, take help from your professors. Take a lot of importance on your internships. Take feedback from the industry leaders on what you're working on, what should be the right areas to focus on. Take as many projects as you can during your stay here. That will open your mind, and that will ensure that you learn as much as possible. And that's what will give you perseverance to be able to survive, to be able to thrive in this industry, which is one of the most challenging but deeply meaningful industry when it comes to having a career in. The third most important thing is positioning. Have your own professional identity. And positioning does not mean self-promoting yourself. I think positioning means understanding your capabilities very well, be open to learning. I think you heard one of the speakers saying that be very humble. You will come across professionals all your life during your learning here, during your careers, where you can learn with everybody. Try and understand the perspective of everybody who is working. While you may be working as a hospital administrator or as a policy maker or as a policy implementer, things on the ground might be very different, and those people may not have the same level of academic qualifications, but the years of experience that they have in terms of service delivery is what will bring a lot of depth to them, and that is what will build your depth as well. So positioning is all about how you are building your capability, how you're building your depth on the subject area, and how you are just not a health management graduate. You yourself should be positioning yourself as a problem solver. And that's where I think India will need the most help on. We will have a lot of challenges, whether it is from a provider perspective, medtech perspective, licenses perspective, public policy perspective. But if you are a problem solver, you will be able to assimilate the feedback from all these stakeholders and be able to still move ahead. And that would be the hallmark of a professional career, which is where you will always excel. The fourth P in this would be patience. And I think comes in very difficult, with a lot of difficulties, but comes in very handy. And as I mentioned, and it is absolutely right, that in your early stages of your career, it's very natural to want to grow fast. And patience doesn't mean that you don't grow fast. All patience means is that you understand systems. Take your time to understand field realities, patient behavior, financing models, stakeholder dynamics. The more you are able to understand, the better you will be to be able to grow in your professional careers. I think as students, we all aspire that we should move ahead with X number of packages, Y number of designations, and others. I think all of them will automatically come to you. Understand this, that it is a 30 to 40-year life cycle that you will go through. It's not a 3-year, 5-year stint that you will be making. You will be having a careers where you will be working for the next 30 to 40 years. You all will have immense choices available to you. You will have immense number of opportunities available to you. You will have number of chances to be able to fail, be back again, choose your careers, take different shape of your careers. So don't be really bogged down by whether I am ahead or behind in my career curve. Every life plays a different path, and you have a much longer career road ahead of you to be able to get into a stage where you start thinking in terms of where are you on the rat race. Easy to advise, difficult to follow, but I think as you grow in your careers, as you become more ingrained on your day-to-day work, you will know more and more that yes, it is not in terms of what you do or what you are from a designation perspective, or much more important in terms of what you do on a day-to-day basis, whether that is really gratifying. And healthcare is an area where you will see that every decision that you make will have an impact on the patient's life, will have an impact on the larger set of population wherein healthcare is being delivered to each and every person on a daily basis. And that's the ethos that you need to keep behind yourself. Fifth, and I think the most important one in the 5P framework is passion. I think healthcare is not an ordinary sector. I think behind every data sets, every policy, reform, digital platform, there's a person who needs better healthcare delivery, who needs affordability, and who needs to trust the system that services are being provided to him. And that's where I think passion comes in handy. You need to be really passionate about the work that you're doing. This sector will be driven by a lot of challenges. You may be, as I think my previous speakers mentioned, you may be doing something different in the morning, but maybe having a very different problem to solve and problem to look at in the evening. But eventually it is the passion that you would have in terms of ensuring that benefit is being delivered to the last mile population, or to the patient who is coming in your institution, or for you as writing a policy maker, that these benefits will go down to the population at large. Ensuring that is what will make the difference. And this will only come in if you are passionate in terms of how you want to make that change happen. Because this is the industry where you can make change and make an impact. And in India, being a country of more than 140 crores people, you will be able to make that impact clearly over the lifespan of your career. As a future leader, I think you need to ask, and you would need to continuously ask yourself, how does your work improve access, quality, affordability, equity, or patient experience? And those are the areas that you should really follow, not in terms of whether you are working in a provider firm, or you are working in a health tech firm, or you are working in a digital health firm, or in a consulting firm. If at the end of the day, your end objective is that the patients are getting benefit, you will be keeping yourself moving in the right direction. And that is what will drive you continuously and will ensure that you're going on the right path in your careers. I think, as I mentioned, the next 20 years will be very transformational. Digital, AI, health financing, public-private partnerships, climate resilience, and new models of care will change the way we look at healthcare being delivered today. And for that, you will need, and we will need, a new set of leaders who will come and succeed, who are very agile, who are grounded, curious, and purpose-driven. I would advise all of you to remain that, to make sure that over the next 2 years, which are likely to be the best 2 years of your life when it comes to learning, bringing in a solid network with your colleagues, with your seniors and alumni, utilize that to be able to learn as much as possible. And that is going to give you a headway right at the start of your career and continue with you in your overall larger lifespan. I think my best wishes to you all, use your time at IIHMR well, build knowledge, build networks, build skills, and build perspective. All of these will be very, very important when you start. Have a lot of interactions. Most importantly, build a mindset for delivering healthcare for tomorrow. I think the more you learn, the more you gain knowledge, the better it would be for the country. And I say this because I, in my own profession, see and interact with IIHMR and healthcare management graduates across the spectrum, whether it is at the national level, whether it is at the provider level, whether it is in terms of the innovators bringing in new set of innovations on healthcare, medtech technology, a lot of personal development healthcare, which is coming up. All of them, you will always find a healthcare management graduates as a brain behind some of these things. And that's where I think it is very important that all of you take advantage of the platform that you've got and be able to absorb that and be able to provide the next set of leadership for the country to be able to take healthcare forwards. Thank you, and I wish each one of you for a meaningful learning journey and a successful career ahead. As mentioned, I will be here for the next couple of hours if you want to meet, Happy to meet you. But again, best wishes to you all. Thank you.
What an incredible way to put thoughts into words and wisdom into perspective. Sir, your words were not merely heard today, they were felt, absorbed, and truly appreciated.
Medicine heals the body, knowledge heals society. Our next speaker represents exactly that. An internationally trained radiologist, a celebrated academician, an accomplished author, and a humanitarian.
He is also the president of Doctors for You, whose work extended to communities that need healthcare the most. There could be no better inspiration for your own journey than someone who has dedicated his life to medicine, education, and service.
So, ladies and gentlemen, let's welcome with the loudest applause Dr. Rajat Jain, sir.
So probably I'm the only odd one out here. Almost everybody is from the management background, and I'm from a medical background, doctor. And whenever I practice as a doctor, there is always a fight that keeps on going that who should run a hospital, a doctor or a healthcare administrator. So before I start, I have a confession to make. Over the last 2 decades, I have taken more than 1,000 lectures. Hundreds of the workshop. I have been invited as chief guest to a lot of medical colleges, lot of universities, lot of schools. But this is the first time that I have been invited to a management program. So when I got this invitation, I was not very sure whether I should accept it or not. And I spoke to my colleague. She said कि सर क्या फर्क पड़ता है, एक स्पीच ही तो देनी है, क्लॉट पे डालना, what is the point, and it will give you the speech, और उसको पढ़ देना. So I said, अच्छा ये बात तो ठीक है, चलो क्लॉट पे डाल देते हैं. क्लॉट ने एक स्पीच बना दिया, मेरे को मज़ा नहीं आया. फिर मेरे को लगा कि चलो चैट जीपीटी पे डाल देते हैं, उस पर भी डाल दिया, फिर भी मज़ा नहीं आया. फिर जेमिनाई पे डाल दिया, ठीक है, उसने एक और अच्छा सा थोड़ा सा क्लब करके उसको दे दिया. मुझे लगा नहीं, आई थिंक दिस इज़ नॉट वर्किंग. देन आई स्पोक टू माई वाइफ. आई सेड कि यार मैनेजमेंट वाले बच्चों से क्या बात करूं, मेरा तो फील्ड ही नहीं है. तो शी सेड कि याद है अभी डॉटर की स्कूल में विराट कोहली आया था, तो मैनेजमेंट थोड़ा पढ़ाने जा रहा है. तो दे हैव ग्रेट academicians, they have great teachers who are there to teach them management. We have already heard from a lot of people who are great. So I will broadly talk about my life little bit and few messages that I have for you. So I'll start with this slide. I have stopped calling myself as doctor and showing my degrees. I call myself very, very proudly a socially aware, medically empowered human being. And I say that there are no limits that you can put to yourself except the limit that you decide for yourself. Can we change the slide, please? So I hope all of you must have gone through this Maslow's hierarchy of need. I am a very, very big fan of this, and I feel that anything that moves in this world is a Maslow's hierarchy of need. For all the young generation, I want you to imagine, just think about it. You are in a desert. What is the first thing that you need? You are lost in a desert. What is the first thing that you need, and which is the most priority thing for you if you're lost in a desert and you don't have anything with you? Yes, I want people to answer. Yeah. Can I say water? Can I water becomes the most priority thing? So this is called as basic physiological need. Till the time those needs are not met, we can't even think about any other need that we have, right? Food, water, shelter, these are the basic needs. The day these needs are completed, then we look to the other sector, which is called as a security need or a safety need. The day these needs are set up, then we look at the social needs, which is the belongingness, right? And when this is being set up, can we go to the next slide? Esteem needs, relationship, what value you have, and finally, at the top of the pyramid comes self-actualization. But the biggest challenge that happens is that the moment your previous need is set up, you are not bothered about that need. इसको किसी ने बोला है, दुनिया जिसे कहते हैं जादू का खिलौना है, जो मिल गया सो मिट्टी है, जो ना मिले वो सोना है. Now, all of you have entered into this beautiful institute. I have lot of regard to this particular institute, though this is my first time to this particular institute, but lot of my very, very close friends are an alumni of this particular institute. Lot of people who are associated with us, who are working and helping me in building the institutions that I have done, are a part of this particular institute. So I have very, very fond regard to this particular institute. Can we go to the next slide? Now, this is what to all young generation I want to put a message. These were the things that I wanted from my life, that I wanted to earn a decent amount of living. I wanted my mother to be proud of me. I wanted my life to be of meaningful and to be of value to society. But the last thing was most important for me. I wanted to sleep without a guilt in the night. Now, all that I wanted in my life is these 4 boxes should be ticked. Can we go to the next slide? Can we go to the next slide? Yeah. So I was born in a very humble background where probably it was difficult even to meet the both ends. Being a doctor was not a dream that I could have seen in the dreams. So as any 15, 16-year-old boy, the dream was to be a cricketer, right? कि cricket खेलना है. But something ऐसा लगा कि ये नहीं हो पाएगा. तो 12th क्लास में आई बिकेम स्लाइटली फोकस्ड कि भाई एजुकेशन इज द बिगेस्ट इक्वलाइजर इन द वर्ल्ड. इफ यू वांट टू इक्वलाइज योरसेल्फ इनटू द सोसाइटी, एजुकेशन इज द ओनली इक्वलाइजर. तो चलो पढ़ लेते हैं. तो पढ़ना स्टार्ट किया. 12th में ठीक ठीक मार्क्स आ गए. आई रोट द एंट्रेंस एग्जाम बट आई कुड नॉट गॉट इनटू एनी मेडिकल कॉलेज. तो आई वाज लाइक चलो ओके ठीक है, चलता रहता है, चलो ड्रॉप करते हैं, दोबारा एग्जाम देंगे. आई स्टिल रिमेंबर आई केम बैक फ्रॉम माई कोचिंग इंस्टीट्यूट. And what happened was my mother was crying, and I asked her, "Ma, why you are crying?" She said, "Don't talk to me." I said, "क्यों, क्या हुआ?" कहती, "तूने मेरी नाक कटवा दी." I said, "क्यों, what happened?" She said, कि चाची आई थी. I said, तो चाची तो आती रहती हैं, क्यों इतनी क्या बड़ी बात हो गई? And I think a lot of you will be able to relate to the point that I am trying to tell you right now. तो ऐसे चाची तो आती रहती हैं. She said, नहीं, वो मेरे को बोल रही थी कि तू तो बोल रही थी कि your son will become doctor. बट मुझे तो पता चला कि उसका एडमिशन ही नहीं हुआ. तो ऐसे, माँ आर यू मैड, क्या बात कर रहे हो आप? आपको पता है कितने लोग एग्जाम देते हैं? डू यू थिंक एवरीबडी गेट इनटू मेडिकल कॉलेज? शी सेड, तू तो अलग है. दिस इज अ वेरी वेरी कॉमन थिंग फॉर अ मदर टू से, ना, सबसे अच्छा बच्चा कौन? मेरा बच्चा. So then she started crying, and as I mentioned earlier, my mother is the most important person for me in my life. So I said, now I have to do something, and I left everything and I completely focused on my exam. And next year, I got rank 9 in the state. And I entered into Maulana Azad Medical College. When I entered into Maulana Azad Medical College, then I saw my mother, and my mother was so happy because the chachi came again. And now this time, my chachi said, अरे हमें तो पता था कि तेरा बच्चा तेरा नाम रोशन करेगा. I have realized this, that we are living in a materialistic world. Nobody care about your story till you win. And that is why you have to win. There is no doubt about it, right? So the first message that I have for all of you is, nobody care about your story till you win. So you have to win. When I entered into Maulana Azad Medical College, I was from a government school. I did my schooling from a government school. Everybody, almost 50% of the student in my college was from Maulana Azad, from DPS RK-Puram, which was so-called the main school. So it was very, very tough for me to establish in the first year of my life. But I realized that I have to create my own space. Very, very early in my life, I realized that nobody will remember how many marks I have got in anatomy or pharmacology. As a doctor, there are only 2 things that will remain with me. Number 1, how good I am as a doctor. And number 2, in which subject I have done my specialization. So very, very early, I became focused, and I said, yes, I will learn the subject. I'm going to make sure that I'm going to not leave anything that will help me in making a good doctor. And simultaneously, I have to make sure that I will get into the good branch. And by the grace of God, I got rank 1 when I wrote my PG entrance exam. So when I got rank 1 and I got these 2 degrees from Maulana Azad Medical College, I felt everything in the life is sorted. Right? But as I said, कि दुनिया जिसे कहते हैं जादू का खिलौना है, मिल गया सो मिट्टी है, ना मिले वो सोना है. तो सब कुछ चलता रहा. The things were going very, very well. I joined radiology. I was doing pretty well in the radiology, but something was amiss. I felt that that's not what I meant for. And then I was searching a lot, and then I came across this beautiful Japanese concept, which is called as ikigai. Can we move to the next slide? Next slide. Next slide. Can we go to the next slide? Okay, all right. So I hope, so I think it is not, there is a glitch, this slide is not coming. So I hope some of you are aware about this ikigai. It says that purpose of living, right? What you are good at, right? What the society need and what you can be paid for. And I realized I am good in talking to people. I am good in explaining concepts to people, and people are ready to pay for it also. And I started taking professional coaching. I started mentoring medical students about how to be a good doctor and how to crack the exam, because these were the two of my major passions. And that was my major area where I started working upon. And I became an author. I wrote few of the books which became the bestseller in the segment to guide the student how you can crack a medical entrance exam. So the life was set. All the 4 boxes were broadly ticked. My mother was very, very happy. I was earning a very, very decent amount that even if I'll retire on the same day, I have enough money that can take care of me as well as my family. But something was amiss. I said, what do you want? So if I ask you, how many of you want to be successful in the life? Can I have show of hands? If I ask you, how many of you want to be successful in the life? Yeah. So I just want to tell you, the day you have entered into this institute, you have already become successful. That is the point. So that is also my thought, that I have to be successful. I have to be successful. But then I realized that rather than being successful, I have to be useful. How I am useful? Because the day I am useful, I am not replaceable. I always say this to my people also, that please be useful. And I say how my life can be of more use to the society. And that can we move to the next slide? Next slide, please. So then comes Doctors for You. One day, I remember we were talking, me and my friend Dr. Ravikant Singh, we were discussing, there is an organization by the name of Doctors Without Borders, Medicines and Frontiers. It's a Nobel laureate organization, Netherlands based, with multiple work across the world. And we realized there is no such organization in India where a doctor who wants to work for the society, who wants to serve the society, but wants to continue with their normal life. What platform do they have? So keeping that in mind, we built up this platform, which was Doctors for You. The idea was that a doctor need not to leave his profession. They keep continuing with their profession, whatever want. And whenever there is a need, they can come and help the people in crisis. The whole idea was that if there is a disaster that happens, as we are speaking today, there is a big flood that is there in Assam. So I am speaking here, but I am privileged that I am able to come here, but my team is there at the ground to take care of the people who are being displaced because of the floods. So what I realized is for-profit organizations and not-for-profit organizations work exactly in the same way. The only difference is one, and that difference is that in for-profit, you take money back home. In not-for-profit, as the head of the organization, you don't take that money. Eventually, you have to make that sustainable. So I started working with this. I realized that this is the same principle that we have to apply, and we started building Doctors for You slowly from the disaster areas. Then we realized that in India, public health is in shambles. Now, if you want to provide equitable distribution, if you want to provide the dream access of health for all, eventually it can only be done through the public health system. Does not matter how much you improve the private health system, this will not be affordable to the entire country. So public health system has to be improved. And I have worked as a doctor across all the sector. Public sector, I was a faculty in LNJP Hospital and Maulana Azad Medical College. I have worked in corporate hospital, both as a doctor as well as a management level, and in a social sector. And I can tell you, every place has its own challenges. Unfortunately, the where you are, you know only those challenges. The other challenges, you do not know about it. So I have realized it. And what we realized is that we will start helping and supporting the public health systems. We created this channel which we call as Bridge the Gap. That means if a public health hospital has a challenge, what could be that challenge? That challenge could be in forms of civil infrastructure, this could be in form of lack of equipments, or this could be in the form of lack of maintenance of that particular equipment, or sometime it could be in form of lack of manpower. We have realized that we will not become activists. We are not activists who's not gonna point that why this is not happening. We will identify the enthusiastic doctors in the public health system who wants to go out of their comfort zone and they are not able to work because of some limitations, and we will help that. As Mr. Deepak has mentioned, CSR has helped us in a very, very significant way, where we mobilize the CSR funds in a very, very transparent way so that those public health systems can be built up. Just to tell you, can we move to the next slide? From starting from a platelet donation drive in 2007, in 20 years, we have come a long way. Can we move to the next slide? And as of now, can we move to the next slide? As of now, Doctors for You work across India. We have 84 offices across India with more than 1,800 permanent staff and almost 5,000 volunteers who help and provide their services to different areas. Now, but why all this is important for you? Now, coming back to the original question, and I have a confession, I want to make this. When I was a young doctor, 2010, the most irritating thing that I used to find in a hospital used to be the management people. And as a doctor, I used to say, ki ye kyo hai? A doctor should run the hospital. And I have no hesitation in saying that I was grossly wrong. I was grossly wrong. I believe the biggest regret that I have in my life, I have achieved whatever that I wanted in my life, but the biggest regret that I have in my life is that I have not taken a professional management degree. I should have taken a professional management degree. The hospital should run by the people who have a professional management degree, because a doctor might be good in their work, but they do not understand कि ये लॉजिस्टिक टाइम पर कैसे आता है. अगर वो 8:30 बजे OT स्टार्ट होना है, तो why it is important to start the OT at 8:30, not at 8:35? What is a bed ratio? If the bed is occupied, why it is important for the healthcare system? This is not taught to a doctor ever. And if you have a professional degree on that, the way that you learn is far, far better. The way that you will be able to manage the healthcare is far better. All this that I am able to build up, all the credit comes to me. Every time I say, oh, you have done it. But I am telling you, I have not done it at all. It is done by my team. Majority of them, the name is Doctors for You, but only 30% of the people are doctor. Almost 30% of the people are from public health background. And MPH is a major area where all my people work and they guide us that this is the way that it works. So I will request all of you to please learn. Don't set a limit to yourself. As Professor Sodani has mentioned, please don't just look in the books, because 400 people are sitting here. Dr. Sodani, all the faculties will give same knowledge to everyone. But who will become Mr. Deepak? Who will become Nidhi Pundir or many more alumni? That is decided by you. That is 100% is going to be decided by you. Stay focused. Have that curiosity that how you can be better, how you can grasp that particular opportunity to learn beyond what has been just taught to you. So these are small messages. I'll be happy to interact with all of you, any of you who wants. Somebody wants to do internship with us. We have a lot of options, both in rural area as well as in the urban area, to see what actually happens on the ground. We have already done a partnership with the IIHMR on that particular part, and I feel that Professor Sodani will help in that. Thank you very much, and once again, thank you very much, sir, for inviting me and sharing my thoughts over here. Thank you. Yes.
So with due respect and all your permission, I want to ask that as a nutrition graduate who is just moving into public health, what skills would make them stand out in the healthcare industry as from 5 or 6 years from now? And as you said that, I also believe in the same ideology that I want to be very useful for the community, not just successful. So how can I make the difference at the community level?
See, nutrition is the biggest area. If I look at it, let's say the talk of the town. But if you just go to the Insta reel and think about that, that's how the nutrition goes, then that's not the way that it goes. It is very easy after 20 years to talk about doctors for you to say that we have 84 offices. Unfortunately, people only look at the success. People do not look at the efforts that you have put up to build it up. Unfortunately, what has happened is that nowadays we have become less patient. Now, if you start working, you expect an immediate result, right? मेडिकल फील्ड में हमें बोला जाता है जो भी चीज इमीडिएट ग्रेटिफिकेशन देती है वो खराब होती है. Delayed satisfaction is always good. So build it up, identify your niche, see what are the areas where the people do not have a right idea. Nutrition is, I will say, if you look at a social sector, the big need of good nutritionist is, there is no limit. Literally, there is no limit. But if you think that you will become a brand in 6 months, that is not going to happen. It will be over a year of struggle, year of hard work, years of rejections. And then you have to look for that one opportunity. We got that opportunity. We were working for 20 years. 16 years after, when COVID happened, the government was struggling to find the beds. And since we have worked in the disasters, we knew how to create makeshift hospitals. Right? So that was the time when Dr. Swarup was recognized. But it took us 16 years for the government to recognize the effort that we do. We were able to set up, because we had a habit of creating makeshift hospital in the disaster settings. So we take hardly 48 hours to set up a 100-bedded hospital. But we had to wait for 16 years for the government to recognize that. So first you have to think about that. Do you have that patience? So that patience is the biggest key, which will help you in reaching to whichever point that you want to go.
Okay. Thank you so very much.
Thank
sir.
you. I appreciate it. Thank you very much.
If knowledge is power, then sir, you have certainly left the room charged with it. Your words remind us that learning is not just about collecting information, it is about gaining perspective and challenging ourselves. Healthcare is built on compassion, but it also demands leadership, strategy, innovation, and relentless commitment. Our next speaker embodies every one of these qualities.
With more than 24 years of experience across India's leading healthcare institutions and currently serving in the strategic leadership role at the Adani Healthcare, she has led hospital planning, quality transformation, digital innovation, and governance at the highest level. A true mentor, an educator, and nationally recognized quality expert.
Ladies and gentlemen, please put your hands together for the incredible Miss Neha Lal ma'am.
Good afternoon, everyone. Good afternoon. Please bear with me for last 15 minutes. This is going to be the last session. It's my privilege and proud to be here on this campus of IIHMR. I was just remembering all my moments, because I think in earlier times when we used to hire the intern, we just used to give the stamp. Okay, this student is from IIHMR and nothing else to us. But let me tell you, that point in time, the competition was less. I think there were only few, handful such institutes were there in India who were imparting the best healthcare administration education. But now we have many in the market. I've been recently visiting few IIMs and they are also doing the healthcare management program. Nothing to scare, but then I think we as a student, as a faculty, as a speaker, as a contributor, I think we have an onus to sustain this legacy with more creative, more innovative way, which is ready for the next generation healthcare world. So that is where I think the journey should start. I think that this full room is consisting of masters in public health. How many are you from the public health? Okay. Healthcare administration? Good numbers though. And how about data analytics, healthcare data analytics? Wow, very happy to see this, yes. And the last and least about pharmaceutical management. Lovely. Lovely, so many. So I have done my pharmacy and I am feeling like, oh my God, that's a complete relevance which is established. I've done my pharmacy. I got into the internship at one of the cardiac institute and I found it, oh my God, this is how the OR works. This is how the whole material management and the drugs and medication management is happening. And that's how I cultivate interest. And I wanted to fly Canada for my master's and I dropped that idea, continued with my internship, extended my internship, learned what is happening inside the OR, and ultimately then I end up doing my hospital management and then the journey goes on. So yes, lovely to be here. As you all are in the one room, there is one thing which I have written just while I was sitting, and I must tell you that we do not have the 4 different groups here. I think we have one ecosystem. If the public health advocate supports a community trend, an analytics architect identifies the pattern, the pharma manager delivers the therapeutic intervention, and the hospital operator designs a room where the care is administered. So I think these 4 biggest pillars are required. Traditionally, the healthcare was treated like an assembly line. Today, it's an interlocking quad. Siloed excellence is obsolete, and the next generation of the leaders must be bilingual in the data where the healthcare analytics come in, operations where the healthcare administration comes in, clinical research from the pharmaceutical management, and the social equity, which is where the public health stands. So I think these 4 elements are put together. My kudos and compliments to Dr. Sarodi, that this is the whole program together and all 500 students attending together, and I think they really do not know the worth of being with each other. I think this is something where you have to collaborate, and this is my talk is going to about. I represent Adani Healthcare, and we are talking this, and we are thinking about this, and look at this whole forum is ready. So the Gautam Bhai said that we did not enter the healthcare because it lacked the momentum. We entered because the momentum was not enough. And that this is the group is going to create that momentum now for the future hospitals. Next, please. This is the vision and mission where I joined Adani 4 years back, and we were asked to thought, okay, let's start something in the healthcare and what should we do? And we brainstorm, and that is how we thought that we also have to do public health as a philanthropic effort. We also have to have some solid differentiator by being patient first, and the guided by our North Star, which are patients relative, biggest stakeholders. Patient will not go out and say that hospital bura tha. Wo relative bolega. Why? Because all this experience from admission to discharge are being managed by the patient relative, and the relative being a healthy individual, he is witnessing all of this in action. So the most important part is patient relative, and we often neglect that. So we have put that also as a North Star being a second. The doctors, the student, nurses, community, every decision serves this order of priority. How can we create such an ecosystem where every stakeholder is protected, every stakeholder is taken care of, wherein we have decided to give each facility for each stakeholders, the workflows. Not only, we always talk about the patient journey, we always talk about the patient workflow. We never talk about patient relatives workflow. We never talk about how nurses' workflow is being managed, how the doctors are operating. How about other community people, those who are working in the hospital? So it's all about people management, whether you're internal people or external people. So when we talk about the hospital, I think there were so many takeaways from my fellow speakers, those who have shared the insight in terms of, one, of course, not being successful, but be the useful, and automatically you are successful. Number 2, you have this opportunity to create something very innovative, wherein you can help the clinicians to do the better clinical care and to have the better clinical outcome. How? I mean, we are the one who supports the clinicians to do better. Think about the data. India does not have the proper data. Gautam Bhai decided that our hospital should create a data inch of the facility. Every inch of the facility should collect the data. Data is then put into the algorithm. We do the data research and then we provide the care. So ours project will be going to be very high in technology. We have, by the way, some 10 interns working for the healthcare planning. Can I tell you the background? They're coming from Digital Institute. They're coming from data analytics. We do not want doctors. We do not want nurses. Why? Because that's a conventional thing. Everyone knows about it because we know hospitals are being run by doctors and nurses. Who else? If you ask the layman. And we know the basic flow. But what do we know? Don't know. That is the power of data, power of research. When we say the research, it's not about the clinical research only. We talk about the data research. We talk about the medtech research. We talk about the equipment research and whatnot. So that is where the whole onus and responsibilities. We talk to the students, we talk to the cross industry, and we evolve. We have a lot of businesses in terms of airports, mining, ports. So we learn from all of this industry. I personally learn from cross industry. Say, for example, when you visit the airport, there is only few counters, and when you go in, and then there is a baggage, and then you get your boarding pass done, and you ask a lot of questions or whatever. That is being done by number of counters. There is a uniformity. And that's how we thought that why can't we have that in the hospital? Why can't we do admission, discharge, billing, registration from one counter itself? I am the patient. I do not want to visit number of counters. I'm aligned, okay, there is a board which is saying me, okay, that this queue is available or this counter is available. I go to that queue and my job should be done. Why we create silos in the system? Why we do not make simplified structure in the hospital where the uniformity, the flexibility, the modularity can happen. So this is how we learn internally and we try to adapt. Speaking on the patient first, we were asked to visit so many centers internationally just to understand what are the best practices. Look at around how the Singapore is happening. What is the model of care? How about the Cleveland Clinic? How about the Mayo Clinic? And this is my own experience because previously I used to run the hospital and only knowing the Indian thing, but this is my learning and I must share that with you. Look around. You are on the plethora of opportunities during our time. We just had Google. And now this is the AI world where you are thrown to the many platforms like ChatGPT. You please understand what is happening in neighboring countries, successful countries. And I think that's a responsibility we have. We learn from many countries, we adopt, we make the feasibility for the Indian context and let us apply, let us adopt, let us put in that practices. I think that is where we should lead as a young generation. Next. Our approach for the hospital planning is the care, patient first clinical excellence. Education, we are coming up with the medical college and the allied sciences and the clinical research, which is the translational research to the care delivery, trials, AI-powered healthcare data lake, and co-creation with the global partners. Speaking on the medtech partners, we work with the Siemens, we work with the Philips, we work with the GE, we work with the United Imaging and whatnot. How do we work? How do we collaborate? We understand what is happening in the medtech world. Our hospital is going to be there in the market, let's say after 5 years, because that is under construction. We want to understand what the future healthcare will demand, not the existing one. Generally, in any Big Four consultancy or any research, we do the feasibility study, very common. What is the feasibility study? We do the market research. We understand the fabric of the city, what is the population, what is the disease pattern, epidemiological study and whatnot. And then we decide the model, okay, this hospital XYZ location should have this, because this is a pure demand supply gap. But no, we are not settling there. We are settling, this is about the existing, what is going to be in the future. How after 5 years, how the city would look like. Because the era has changed. The healthcare has evolved. Look about the other industry. Day before yesterday, I was at the Delhi airport. And because the Delhi is somewhere where people generally travel off. So earlier, with that washroom cluster, we used to have a lot of queue, okay? Because there are only few compartments and the females are waiting for getting into the queue and getting into the washroom. Now, they have maintained one dashboard outside the washroom. And that tells me this many vacant, this is occupied. No one has to go inside. Wow. I mean, what a transformational change. Now, this is a very simple thing which technology has adopted. When I visited the Mayo, it's not about, we do the hand hygiene practices in the hospital, and there is an infection control nurse who traces the hand hygiene practices and the hand hygiene score, that how the nurses are followed. There at the Mayo Clinic, if I'm a nurse and I'm just washing my hand or I'm just sanitizing my hands, there are the screens available outside the patient's room. I have to screen my palms. The screen will tell me whether I've done it properly or not. That will be completely scanned. And if I'm 100% compliant, then and then I'll have the access to the patient room. Now, that's a simple technology. Of course, there is a cost involvement, there is a one-time investment, but there are a lot of such issues can be resolved by the technology and data. Why I'm just forcing here on data, because I want the healthcare administration people to work with the digital analysts and digital analysts to the public health and the healthcare administration. It is going to be a biggest opportunity when we transform the healthcare operations altogether. Next. Next, please. Next. These are the two buildings I'm showing here about the Adani Ahmedabad and Adani Mumbai. The Adani Ahmedabad project is about 1,500 bed project wherein the medical college, teaching, corporate hospital, research, everything is going to come as an integrated ecosystem. Wherein the Mumbai will have 2,500 bed. It's a larger setup. And then we are also having a few more projects, that is Chennai, Patna, Kolkata, Vizag, and Delhi. So these are the few projects in pipeline. These are the futuristic project, and this is how I'm just telling you, this is how the need will be. When we are promising our patients, patient relatives that we are going to give the affordable care, how? What will be the business model? So that is where our whole calculation, our whole understanding of the market, that how do we make it affordable, not only to PMJY, but non-PMJY patients as well. We have collaborated with the Mayo Clinic for the clinical protocols. We do not want to have the subjective clinical protocol as per the clinician wishes. We are going to have our own established clinical protocol where our physicians or our clinicians will be trained enough to follow that. And that is completely digital in terms of EMR. From the Sing Health collaboration in the Singapore, we learned that there has to be control command center wherein real-time data flows into the system and the real-time monitoring and the corrective actions are taken in the hospital. It should not be post-discharge, rather it should be the pre-discharge wherever there are bottlenecks in the hospital. Likewise, we have had expert for each area, and they are, say for example, laundry is one service in the hospital. We have the laundry expert working for the project 24/7, only laundry. So that person has to think about what is best which is happening in the world with regard to the laundry in the hospital. Then and when you can understand what is best, and then you arrive to the model, something like that. So that is something as a modus operandi we have adopted. These are the 10, next please. 10 guiding principles which we have set for healthcare. The biggest philanthropic commitment to the independent India. Interplay of 3 pillars, which is the care, education, and research. National impact at fastest ever scale. Strong commitment to reduce the patient financial burden. Future-ready medical professionals across the spectrum. We have acquired one university in Maharashtra, which is Datta Meghe University, which has got 10,000 students, not only medicine, they have got complete ecosystem. I've just sent the cohort of 15 doctors to Singapore just as an observership, just to observe that what they are doing and how they can come back and they can, improve and implement in their own department. So we are already in the process of creating future clinical talent so that they can be then employed to the Adani Health City. Best-in-class outcomes via global partnerships. India-centric breakthrough with the clinical research, because as I said, the momentum is not enough. There is a lot to do. Technology and AI to leapfrog access for all. We as Adanian are asked to live, breathe, eat technology. We literally live in technology. That's kind of innovative practices are there, and we are really, really privileged enough to get access to all of these things. And seriously, there is a lot happening outside India and outside world. I think one has to really dig the information and work towards it. infrastructure at the heart of city for the equity, adaptive, reconfigurable design for the crisis response. Someone talk about the COVID, the hospital will be COVID ready in future times, but how? So that whole iteration and the strategy has gone into place, that how do we create a better healthcare, hospitals for such a whole pandemic which can come in the future itself. Next. So these are some of the reflection points which we asked when we started designing, that are we designing our hospital as buildings or as ecosystem? Because the pivoting is very, very important rather than the planning. And the pivoting is something to do with not thinking out of box, but I think reinventing the box. And when we reinvent something, there is no historical data available. And these are quite challenging stuff. That is what we have been doing. Are we optimizing for the volume of the patient treated or the lifetime patient value? How about touching patient life from preventive healthcare to the rehab, the whole cycle? So we create kind of, digital ecosystem where the first time the patient has registered in the hospital, the patient belongs to Adani, and then we take care of that whole life cycle management, not only the patient, the whole family. Are we investing into the reactive infrastructure or preventive touch points, which is the future, the screening, digital, home healthcare? Are we treating diagnostic as a service delivery unit or a clinical decision regime? Are we building for today's regulations or for the tomorrow's expectations? I think the regulations, statutory compliances are also evolving day by day. So are we creating as for ready, and what is being baked in the regulatory system as a future? So we are compelled to understand that what is going to be in the future in terms of reforms. And based on that, we consider in our approach while we design the hospital. Next. So traditionally, the healthcare was treated like an assembly line, and today is an interlocking quad. The next generation, as I said, must be bilingual in data. If you do not have the data literacy, you can't. I'm not talking about the financial data, I'm talking about as a whole. Operations, clinical research, and the social equity, because this is the 4 pillars, I would say, and that you are in this one room, are interchanging, and I think there is an intradependency to all the healthcare future professionals. So there was one short story which I just would to narrate. I think this was relevant before, that there was one sales executive who joined one new company, and the manager asked him that, okay, your job is, he was very excited for his job. He said that, okay, you have to go to this X place and start selling the shoes, because he was working for the shoe company. One fine day, he was very excited. He had gone to that village, city, whatever village, I believe it was a rural area, and then he found that nobody is wearing any sleepers, forget about the shoes. So he got so disappointed, called him up. Boss, where are you sending me? आप मुझे कहाँ भेज रहे हो? ये लोगों को स्लीपर्स ही सेम पहनते, तो मैं शूज कैसे पहनाऊंगा? And the manager said, that's where the market is. You have to make them aware there is a shoes which is there, and you have to make them wear the shoes, right? You are at this stage because earlier times we used to really push the patients and the community to get into the preventive healthcare. कि एक movie कम देख लो, but एक health checkup करवा लो. It's a preventive healthcare is much, much better than the reactive treatment. But these days, people are aware. That era has gone. People are aware about the preventive health checkup. They are into the wearable devices. Everyone is watching their blood pressure and vitals day in, day out. Now the data is created. Now people have adopted. Now there is a real challenge that where do we create market? Are we really making a value in the system? So this is whole rapidly evolving era. And in earlier times during my accreditation journey, when we used to see the SOPs and policies and protocols, we used to say that it is not documented, that means it's not followed. Again, I am saying the data is not recorded, that means it's not followed. So that was a documentation. Now documentation, manual documentation has taken into the shape of data. So my biggest urge to everyone to take this opportunity ahead. वो पहले बोलते थे कि जितनी चद्दर हो उतनी ही फेर फैलाना चाहिए. Now the thing has changed. चद्दर बड़ी हो जाएगी, पैर फैलाना सीखो. So I think that is where I want to end my talk. Do not ever settle for less. keep your hard work, keep your smart work very high. Be a differentiator in the system, be differentiator in your class. Think innovative, think creative. There is huge world out there to learn. No need to be in silo in only health hospital. Go out, explore other industry, and there are so many takeaways from other industries as well. So stay strong, all the very best. You are at the best institution. I wish you all the very best. Thank you.
Thank you so much, ma'am, for the truly enriching session. You didn't just speak about healthcare, you made us understand its real impact, challenges, and possibilities.
As a mark of our sincere gratitude for sharing your invaluable time, wisdom, and inspiration with us today, we now proceed to the felicitation ceremony.
May I please request Dr. P.R. Sodani, sir, to kindly present the token of appreciation to our esteemed guest. A heartfelt round of applause, please. Mr. Vijay Ratna Venkatraman, sir. Mr. Deepak Venugopalan, sir. Mr. Nilesh Maheshwari, sir. Dr. Rajat Jain, sir. Miss Neha Lal, ma'am.
I would also like to request all our dignitaries to step forward and pose for a group photograph for a visual memory of this beautiful moment.
As we conclude this inspiring inaugural session, let us remember every hospital we build, every patient we serve, and every life we transform
ultimately contributes to the progress of our very nation. May I request everyone to please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Please be seated.
Every ending is in truth a beginning waiting to happen. Today, you walked into this hall as newcomers. You will walk out as the members of the IIHMR family.
May each one of you leave this university not just with a degree, but with the courage to transform healthcare and lives. To our dignitaries, faculty, and our parents, thank you for your trust and support.
And to our newest batch, welcome home. Your lunch awaits at the IIHMR canteen. We resume sharp at 2, so be quick because something interesting awaits you after lunch. Thank you and have a wonderful orientation program ahead. Jai Hind.
Jai Hind.